Hi there, I'm Dr. LaQuita J, and welcome back to my YouTube channel where I talk about all things in between being and becoming a pharmacist. How you doing? You all right? Welcome to Success Sundays. As you do know, I am a Naplex Success Coach. I help pharmacists pass the Naplex exam in 6 months or less by shifting their mindset, strategizing their plan, and study effectively for the Naplex exam. And in this week's content, this week's training, I want to talk about the NABP Naplex Competency Statements, or now that they call it the NABP Content Outline for 2025. So let's get into it. First things first, if you do not know, you should know this is the outline you want to follow. You're studying for Naplex exam because this is the outline that gives you the knowledge, the outlook of what to expect from your Naplex exam. It gives some kind of things of what you should know as an entry level pharmacist. So before we get into it, I want to compare because some of you all will be taking the exam prior to May 30. May. Let's see, it's May. When does this go in effect? I have to see. I believe it goes into effect May 1st. I would say May 31st. So before April 30th, you'll be taking the exam. And I want to give you some insights for those who are for taking this exam, do some comparisons and things of this nature, right? And I'm not sure in this video or not. This is more educational comparison. I'll probably give my opinion in another video, maybe next week. So, but this week we're going to focus on the comparison of the two. And I was going to do a slideshow and all that. And I just said, let's just bring up the competencies and let's just go back and forth and talk about some different things, right? So let's get started. When it comes to the competencies of these, and you have competencies 2021. This is like the comparison of the statements versus 2025. Now, some key overall things that you will see in various similarities when it comes both again, both documents serve as a blueprint for the NAPLEX, outline the competencies and the knowledge required for the pharmacist. The general goal of this is to evaluate entry. The general goal of NAPLEX is to evaluate entry level pharmacists' knowledge and judgment remains consistent. And the key differences, if you look at the documents as a whole, is that the 2025 document introduced a more structured format framework with 5 major content domains instead of the 6 that were mentioned in 2021 version. And addition, these details on more so the development process, stakeholder engagement, and survey and things of this nature. Now there were some additions because as you can see here, in competencies areas of 2021, this is 2021, they only had about 6. That's areas 1 through 6. Versus you see in 2025, they have more robust. They have those domains of 5 domains. So you can see the complete difference in those two. Now, with the new content domains, these include foundational knowledge for practices, medication use for process, person-centered assessment and treatment planning, professional practice, and pharmacy management leadership styles. There's more detailed description that includes, subdomains and third-level domains that was not included in 2021. So it kind of gives you a certain thing, but there are just in general were some deletions where in this one they do not necessarily have 2021. It has been real structured, like they don't really necessarily mention the compound part of it, but it still mentions just how it's organized from that perspective. And then it's also too just different terminologies. Like if you can see here, when it comes to 2021, they have more action words like obtain, interpret, assess. That's said in 2025, they don't necessarily have that. But y'all, like, let's get to nitty gritty, right? So the key difference is one, are going to be the domains. Domains are the key difference and things that you will see different again. 2021, you got 6 domains, and 2025, you now have 5. So that's key difference. We'll break down those domains and more as well. But let's go into the content. The differences is the content organization. The 2021 competency statements, they are more like again grouped into the 6 domains. It's more so focused on the individual pharmacist actions such as compounding, calculating dose, and obtaining data. Versus 2025, it more so consolidates and reorganizes into a broader like overlapping of the domains. It includes a total like hierarchy structure with domains, subdomains, and subdomains for like a granular breakdown. And there's more emphasis on systematic processes versus the individual. And again, like I said, the terminology is different. 2025 feels more of a conceptual and process-driven language, like foundational knowledge, person-centered assessment, versus again, you have more action words in 2021, obsess, obtain, those things. In terms of content weighting, you have approximately percentage of the test assignment for each. In 2021, you had like the different assess to the competency areas of it. But in 2025, you see it provides more specific percentages for the broader domain. For example, in 2025, let's go here. They have it's more like this person-centered assessment and treatment plan. That's more 40% of the exam. That's about 80 questions for there. So it's more centered in that area. And let me make sure you can see a little bit. Well, you still can see it. I was like trying to see, you still can see it if it don't matter. But that's one of the things. So maybe if I do this. No, it don't matter. I was trying to play with the image, but it doesn't matter. But that's one of the things of competencies of the area you see more of additional. And again, too, it's like in 2025, they specifically admit the sessions of performing calculations and compound the distinct portion of it. It's not one of the domains that you saw here in 2021, where they had like calculations. That's area 4 and area 5. Well, that's area 4 there and area 5 compound. They don't necessarily have it there, but when you look at it and you go close to it, it's really in in domain 1. So instead of having area 3 and area 4 and area 5, area 4 and area 5 is in domain 1. It's a part of it. So it's not like it's been omitted from the exam. It's just inside of a domain of 1. And again, when it comes to domain 1, it's only 50% of your, or like 25% of your questions. So that's another thing too, knowing like your drug knowledge and stuff like that. And if you look at it kind of closely, honestly, my opinion, well, I say looking at it closely, my opinion, but you can kind of see that where here in area 2, they have the pharmacology. I know they have pharmacology there, and they mentioned area 3. They have the pharmacokinetics and pharmacodynamics in area 3, and again, you got area 4 calculations in area 5 compounding. In 2025 document, this is all part of 2025 document. So it's not like they omitted some. It's just how they organize the information. So you're still going to have calculations. You're still going to have compounding. You're still going to have pharmacokinetics and pharmacology. It's just how it's organized. It's on 25% of your exam versus roughly 25% plus. And when I say 25% plus, because when you look at it, this is 11% of your exam, and this is 14%. So that's already 25. They just add a portion of there and a portion of this. So it's exactly like 25% of the exam from that perspective. And then we go into you talking about the similarities. Again, both of them really outlines the document as a blueprint for the Naplex. They both cover the critical areas: drug knowledge, treatment plans, calculations, compounding. But the 2025 does provide a bit of advantages, like the clarity and structure. NABP has done this job, and typically, like every 4 years, they'll come in and they will add more things. They have done more, have like a little more hierarchical framework, which makes it easy to follow. How, but it's still, in my opinion, still gonna be vague unless the reporting is different. And I do like in the advantages of 2025, they became more relevant. Like they're still focusing on emerging pharmacy trends that we see, like leadership, public health, even social determinants. And luckily for my clients, I have a master's in public health, so we can talk about that right there, right? And then we'll go into those things, the determinants of health and public health from that aspect of it. And it's also on trend because it's showing that where we are going as a profession. It's my opinion only. If I say this is my opinion. Now, I did not represent any MVP, any organizations. It's Dr. LaQuita J talking, and it goes into the direction where we're going as a profession, because as a profession, we are becoming more clinical. I do believe in the next 5 or 10 years that we will be the ones who are managing so we are fulfilling the gap of when there's a shortage of primary care physicians, because we can manage the comorbidities, like the common comorbidities of diabetes, hypertension. We're already doing it in certain sectors like the VA. We're already doing it in ambulatory care. So I believe there'll be more aspects of that, us as pharmacists, and that's the thing, we're going to be needed, and it's showing. And it just seems like the profession is asking us to think more clinically, be more critical, because we are healthcare providers, and we have fought so hard for us to get the provider status, and it's more of us going to direction of where we need to go. I know y'all heard the excitement. I know I got really on the groove because that is my thing. I'm telling you, we are the most accessible healthcare providers ever. You don't necessarily need an appointment to go see a pharmacist. You can have a healthcare consult. You can have a consultation out and say you'll be at the doctor. So it's definitely one of those things where the untapped market not being used. But back to the advantages. And another advantage is the integrated knowledge. Like it's really providing 2025 is really providing a more comprehensive approach to the pharmacy practice. That's definitely one that's coming. Am I bleary? Just a little bit. Okay. It don't matter. We'll keep on going. And it's like, reducing the redundancy. And also too, it's more practical preparation. Like, they have more, the simple questions demonstrating real world conditions and things of this nature. So the benefit of this, you as a test taker, is that you do have more broader domains, but it's more with specific subdomains to guide you with study prioritization. Because at the end of the day, like, and when it came to 2020, one, I was doing these calculations of, saying how many questions this, and it's like versus here, that the exact amount of questions coming. So it is a bit more robust. You give you guidance of saying that, hey, on your exam, you can expect 80 questions from this portion, 10 questions from this portion, 10 questions from that portion, like spend a lot of your time. As me as a coach saying, you gotta spend a lot of your time in domains 1 through 3 for sure. Let's not knock 4 and 5. It's easy questions, but make sure we got 1 through 3, that's definitely a thing of it. It is more robust, and it helps you to identify that. And I love that it emphasizes more current practices and the public health initiatives, and they're like, both focus on functional knowledge and application to really make sure that ensure that a patient, you are really ready for a patient. But that's like a quick overview and things of this nature. But I want to get more into like details of this information. Like, let's go into more details. And yes, let's start here with domain 1, right? The foundational knowledge versus the data assessment and calculations. Now, the 2025 foundational knowledge, this domain expands upon the content from, like I said, area 1 and area 4 in the 2021 outline. These, like those topics such as pharmacokinetics, pharmacodynamics, biostatistics, and laboratory measures, they remain consistent. But the 2025 outline incorporates additional elements such as the drug development process, i.e., those clinical trial phases, emergency use authorizations. You also have more sort of research design and biostatistics as well. The inclusion of these advanced concepts in 2025 outline really reflects in an effort to prepare pharmacists, will prepare us for more evolving, again, the evolving role in clinical research and more evidence-based practice, whereas the 2021 framework really focused on more narrowly on data acquisition and interpretation. So that's a key difference. When you get into domain number 2, I'll tell you, yeah, you can see that. It's like, you can see that, yeah, you can see it's domain number 2. This is the medication use process versus the drug characteristics and administration from 2021. So the medication use process in 2025 outline, it really integrates those elements from Area 2, Area 5, and portions of areas in the 2021 outline. For example, when you in 2021 Area 2, it included like box warnings, REMS, and drug interactions, which are now a broad is a more broader process in 2025. And medication compound and storage is previous like standalone topics in 2021 with Area 5, but now it's more encompassing in the subdomains of like it's under medication handling, storage, stability, and disposal in 2025 document. So this integration of these tasks is a more cohesive approach that reflects on a more systematic approach to medication use, which really focuses on pharmacists' role again across the entire medication life cycle. So that's very, very important. When you go to domain 3, the person-centered assessment and treatment planning, the 2025 domain is an evolution of Area 3 from 2021. Written while the 2021 outline emphasizes more on task-specific competency statements such as therapeutic monitoring and non-drug therapy, the 2025 outline really expands on their patient education and their lifestyle modifications. It focuses on the adherence and self-monitor devices. It focuses on the errors and the omissions in therapy. This domain really focuses on the patient on the patient aligns with like the modern healthcare emphasis on patient-centered approach, that population health management, while 2021 just limits this. And then, of course, again, the new addition. Oh man, what happened? Figure so. In the domain 4, the professional practice in public health in 2025, like this is introduces these topics that's completely absent from 2021, and it's more of the adverse effect, adverse event and medication error report. And we kind of know about like med watch and VARS, VARE or VARE or VAERS. Sorry. And then it's just like again, the social determinants of health and the public health initiatives and ethical consideration. And this addition again really truly reflects on the growing role of a pharmacist in public health and our responsibility, because this is one of the reasons why I got into public health, because I believe that even like I want to help prevent the problem sometimes. And it's like how we can really help in public health and in our responsibility for addressing, systemic factors that influence a patient outcomes. That's why I look, man, that's why I got into this. And I really love this approach that we're now taking as a profession for domain 4. And then you have domain 5, which again is new compared to 21, another new addition. This emphasizes pharmacy operations, inventory management, quality improvement activities, the mentorship and preceptorship, the highlighting of pharmacist leaderships in practice and settings. This domain does not even have a direct counterpart to 2021, which focus more on, narrowly and technical things. And again, this is just really shows that how 2025 is really having those advantages of we having an integrated approach by we consolidated competencies into broader domains, in which the 2025 outline provides some more cohesive understanding of pharmacy practice. You also have the alignment with modern day practice, again with the social terms of health, public health, leadership reflect. You also have a comprehensive preparation with the research design, the drug development, more the patient education, better prepares more you for the real world challenges that you do have as a pharmacist. And it's more hierarchically clear. So in my opinion, and this is just a shift, and I think we're gonna stop here, and I'll wait next week. I'll go in more details of if I was a pharmacists preparing for the exam, how I prepare for the exam based off these 2025 competency statements, right? But right now, I just really want to say the key differences in the things to highlight from each one. But the thing is, the shift from 2021 Naplex competency statements to the 2025 Naplex outline really just reflects on a significant evolution in the assessment of pharmacy practice. The new framework really emphasizes integrated knowledge, the patient-centered care, the broader professional responsibilities that we have, and these changes really align with the pharmacy trends, making the 2025 outline more comprehensive and relevant guide to entry-level pharmacists. I do believe in this, and there's more details about it. That's just my personal opinion with this, and I do like more of that. It does provide that. I was talking so good, I forgot to change the screen. Anywho, um, but with this here, if you look closely and just simply put with the comparison, it does offer more things, but it's the organization of the information. Like when it comes to area 1 and 2, like I said, they are they're intertwined in domains, and then area 4 and area 5 is really comes in and just makes it more robust. Area 4 and 5, but 1 through 3, yeah, if you just read closer, you go through the statements. In a sense, 1 through 3 is something 2021 always had. It's nothing too different from that. And even like certain things it does say, adverse drug report and things of this nature, those things were mentioned in 2021. It's just differently, it's not directly said that from that perspective. So those are my thoughts and things of it. I do think we're like, again, really happy in the direction of where we should be going, as we go as a profession. And again, I thank you guys for joining. I hope it's very information. I hope you say like, okay. And if you want me to break down anything or go in more details about a certain area, let me know in the comments, and we'll record a video. But let us know what what you want to see, what you want to hear. As always, let us know. We do like feedback. Please always like, subscribe to our channel, like, comment on our videos. We love the interaction. We welcome the interaction because it helps us to continue to produce more content that you like for our viewers. So please let us know you want any more thing. And until next time, remember that pharmacy is on limit. If you are, now go be great. I will talk to you guys later.